Good afternoon, everyone. Happy Tuesday. I am Estela Mata.
And I am Juana Mata. We are the Mata sisters from Looms for Lupus.
Yes, and we are so excited to be here today because we know that information is something that is crucial, that is needed, and will help us manage our chronic conditions, specifically lupus. And we're excited to bring you this information. So if you guys know, or if you're just tuning in for the first time, Looms for Lupus is a nonprofit organization that was founded by my sisters and I when Juana was diagnosed with lupus in 2009. We wanted to make sure that we supported, raised awareness, and also provide you with resources, not just the individual living with lupus, but their loved ones and caregivers as well. And we just want to make sure that you are ready for this live symposium because we are partnering and collaborating with Aurinia Pharmaceuticals and the All In for Lupus Nephritis program to bring you the information that you need to know about what lupus nephritis is, how it affects your body, and to learn more about this amazing program.
Exactly, and we're super excited. Hopefully, everyone gets to get their questions answered. Please share with everyone. We need to bring this to light for everyone to learn and understand the symptoms of lupus nephritis.
Yes, and with if you have any questions, please join in the conversation. Put in your questions on Facebook. We have some pre-submitted questions. We'll go over them. We are going to start off and kick off our event right now, and we are going to be introducing Michael Portali from Aurinia Pharmaceuticals, so he can introduce our provider that's going to be giving you all this amazing information. So please, Michael, can you come on and just join us on the screen? Hi, Michael.
Hi, good afternoon, everyone. Welcome to today's program. At this time, it is my pleasure to introduce your speaker for today's program, Dr. Laura Geraldino Pardilla. Dr. Geraldino Pardilla is an assistant professor and director of Lupus Clinic at Columbia University. She graduated summa cum laude from Intec University in the Dominican Republic and afterwards moved to New York to complete an internal medicine residency in SUNY Upstate, followed by a rheumatology fellowship at Columbia University, where she stayed on as a faculty member. Her areas of clinical and research interest include lupus, rheumatoid arthritis, and musculoskeletal ultrasonography. She has been the director of the Lupus Clinic at CUIMC since 2010 and has been awarded a Rheumatology Scientist Development Award from the Rheumatology Research Foundation and an investigator-initiated Pfizer Award to study cardiovascular disease in lupus patients. Her prior research experience as a recipient of the CTSA Award and an NIH supplement grant focused on the role of specific ACPAs in cardiovascular disease in RA using different cardiac imaging methods. In addition to being a board-certified rheumatologist, she completed a fellowship in musculoskeletal ultrasonography with the Ultrasound School of North American Rheumatologists and serves as the director of the FAST Arthritis Sonographic Evaluation and Treatment Clinic at CUIMC. Dr. Geraldino Pardilla, you may begin.
Hi, everyone. It is truly a pleasure to be with you today, speaking on behalf of Aurinia on the topic of lupus nephritis. And this is something that's really close to my heart because for over a decade now, I have been taking care of lupus patients, and this remains one of the main manifestations that leads to poor long-term outcomes. So I'm so glad you're able to join us. So let's get started. So we'll talk about lupus nephritis, but before we get down to the details, it's important we touch base on a few things on the root of the disease, which is lupus. So as we know, lupus is a systemic chronic condition that can have multiple complications. So what happens is that our immune system that normally, for example, attacks bacteria or things that are causing infection or malignancy starts attacking our normal healthy cells. So what happens with that is that can result in inflammation and injury to multiple parts of the body. So that could be the skin on some occasions, the joints, the heart, the lungs, the brain, the kidneys. So when lupus involves the kidneys, that's the condition we call lupus nephritis, which we'll be focusing on today. And it's not so rare. So it's about half of the patients that are living with lupus have involvement of their kidneys at some point during the course of their disease. You can go to the next slide. So let's see. Let's move to the next slide. Next one. Next one. And there we are. Let's see. One more. Perfect. So as we know, when lupus is involving the kidneys, that leads to inflammation. It's what I was mentioning. So when that goes on for some time or it's not resolved, that can lead to long-term irreversible changes in the kidneys, and then the kidneys don't start functioning properly. So then they're not able to really handle the waste to eliminate from the blood and to control the amount of fluid and other contents like proteins or electrolytes that are in the body. So that can, as you can imagine, lead to serious healthcare problems because if those kidneys get permanently damaged, then that leads to complete renal failure, and then we might be in need of dialysis or a need for a kidney transplant. Next slide. Next slide. So now we'll talk about who gets affected by lupus nephritis. Next slide. So we know it's not as rare as people think. It's actually about 100,000 people in the United States alone are living with lupus nephritis. And out of those people, 1 out of 3 actually gets diagnosed at the same time as their lupus. So it could be even more challenging there when it's someone who doesn't already have that history of lupus and gets that kidney issue, it starts having kidney problems, and there's even a harder time to figure out what's the exact cause of that. Next slide. And in general, genetics have a great contribution as well, because we know that, for example, Blacks and Asians have 4 times more likelihood to have the kidneys involved by the lupus when compared with whites. And Hispanics and Native Americans also, to some extent, about twice the likelihood of having this happen. So how do we know? What are the signs and symptoms that can make us think that this is happening? How do we diagnose lupus nephritis? Next slide. So some of the signs and symptoms can be quite subtle. So, and even hard to recognize. Some of those involve swelling. So usually that can happen in the legs. It could be the whole leg or feet and ankles. And because of fluid retention, often we hear people say, well, that they had a sudden change in their weight. So a sudden, increase in weight can be one of those signs. Usually comes with increased urination, so having to go to the bathroom often. And when going, seeing foamy, very bubbly or frothy, described as urine, kind of like when you pour detergent into a toilet bowl. So those are some of the features that could be noted. But as you can see, they can be subtle. They're not very specific or very easy to recognize. So in the early stages, especially of lupus nephritis, there might actually not be anything that could be recognizable. So because of that, it's really key to rely on some other tests or methods so that we are able to detect when this is happening early on. And most of it comes from doing urine and blood tests. So the urine test is quite key because when your doctors are checking the urine, they can see if there's leakage of protein. So that's what's called proteinuria. So they actually measure how much protein are your kidneys, leaking. And similar to that, in the urine test, they can also see if there's leakage of blood. So that's what's called hematuria. And some of these abnormalities then gives your doctor an idea that there could be some kidney involvement from the lupus and do further testing. Some other abnormalities that can be picked up, not on the urine, but on the blood, include abnormalities with the electrolytes. Something also that's measured is the glomerular filtration rate. So you'll see throughout the presentation called as GFR to make it a smaller term. But it's just the ability of your kidneys to filter. So when that's not working properly, then those numbers go down. It's decreased. They're not able to filter as much. Also, that tends to come along with an elevation in the creatinine levels. And we'll talk a little bit more about what the creatinine exactly means. And while often not symptomatic, it doesn't give you any symptom, an increase in your blood pressure, which, will just be detected once it's measured at your regular clinic visits, for example. But ultimately, to confirm the diagnosis, what we do and rely on is the kidney biopsy. In the kidney biopsy, we can see the inflammation, scarring, and how much damage has occurred to the kidneys already. Next slide. So, in some, when these kidneys are impacted, we might think of things being contained to the kidneys, but it's not really like that. Other parts of the body can also be involved. It's like similar to other autoimmune diseases, like, for example, diabetes, that's very well known. Serious health care problems can happen, which are not just limited to the kidneys. We often see that there could be an increase in blood pressure. And with this, we can have also some increased risks for cardiovascular events. So things like heart attacks or strokes. So it's not that the kidneys are not enough, but it usually can come with other actual healthcare impairments. So in addition, lupus nephritis, of course, if that progresses, can lead to kidney failure. So, and then that comes with a need for any alternatives for supplementation like dialysis or a renal transplant. So because of this, what we'll be emphasizing throughout the program is the need for really early diagnosis so that can lead to prompt treatment and that we can prevent some of these complications and have good overall renal and extra-renal or other complications from occurring. Next slide. So what I want to walk us through now is that road to a diagnosis. So how is someone diagnosed with lupus nephritis? So, because it's really high risk, we said it's 1 out of 2 lupus patients actually develops lupus nephritis. So because of that, your doctors are routinely testing you to check if there's any evidence that this could be happening. So we'll talk a little bit about what are these tests and what's really being performed. So the most commonly performed test to detect this is the urine test, so a urinalysis. So what's looked at there specifically is, as I mentioned before, that protein that's leaking through the kidneys, and it's measured in the urine. So that really helps your doctors be able to detect early on if there could be an abnormality with your kidneys. And usually, even if you're not having any symptom, even if it seems that the lupus is very quiet and doing well, your doctors will be checking this urine test at least every 3 months. Every 3 months, that's being checked to make sure there's no abnormalities there. So often this is done by your rheumatologist, but of course it could also, having lupus, you're probably involved with a team and having some multidisciplinary care. So often nephrologists, the kidney doctors are also involved, and they can be the ones ordering this test and monitoring for that as well in conjunction, with your rheumatologist. Or it could be even your general, primary care provider. But the important thing is that this is being looked at periodically, even if everything seems to be doing well. Next slide. So, most often the rheumatologist really and the nephrologist are the two main specialties that are monitoring this and that are diagnosing the lupus nephritis, because they're seeing you routinely, they're checking on those subtle signs and symptoms, and they're measuring your urine and your blood tests to see if there's any indication of your kidneys having any sort of impairment. Most often the rheumatologist, when you haven't already had kidney disease as part of your lupus, but in that, remember that 1/3 of cases in which I mentioned that people are diagnosed both with lupus and lupus nephritis at the same time. So in that scenario, often then it's the kidney doctor, the nephrologist, that gets involved and gets to diagnosis. But however it starts, it's usually treated and monitored in conjunction. So you will have your team of doctors, so both rheumatologists and nephrologists work together to assure the common goal of getting things improved. Next slide. I think we went, okay. So what are those, I just want to summarize what are some of those tests that really get us there to the diagnosis. So we've mentioned many times on the urine test, because that's vital. That's simple. We measure how much proteinuria, which was that leakage of protein in the urine, and that gives us an idea of abnormalities in your kidneys. We also look at blood in that urine, so it serves for those two purposes. In the blood test, we mention the glomerular filtration rate, the ability of the kidneys to filter, but also the creatinine. They come hand in hand, and that creatinine is the result of the breakdown of muscles. So if the kidneys are not able to filter properly, then we see that those levels go high, they elevate, and that gives us also an idea of on the health or the ability of your kidneys to function properly. And ultimately, the kidney biopsy, I cannot emphasize more how this is really important for confirmation of the diagnosis, not only because it shows us the degree of inflammation, the degree of the kidneys that has already been permanently damaged, but it also guides us in terms of what are the best treatment options to pursue after that. So that's really those are the three ultimate tests that help us diagnose lupus nephritis. Next slide. And now I'll touch briefly on how we manage the condition. Next slide. So as you're probably very aware of, when treating a severe manifestation of lupus, so we tend to rely on immunosuppressants and steroids. So usually the steroids help us get that inflammation under control in a relatively fast manner. Like steroids work in 24, 48 hours. So that's why we still, despite, all the other medications we now have for lupus, we still need steroids to do that fast action. And, and that goes along with the immunosuppressants that take more time, but then come in to help us in the long run. So usually at the beginning, at the onset of the diagnosis of lupus nephritis, we have to rely on high doses of these medications, the immunosuppressants and steroids, but then they're further tapered down, decrease in doses over several months, making sure that things remain controlled and then they don't go back to flaring and, causing further damage. But along with that, we also rely on other medications, such as blood pressure medications, not only for the patients that have high blood pressure along with the nephritis, but also for people that, just have the nephritis, and these medications can help them prevent further progression of the disease, regardless of what the blood pressure is. So we use it for both benefits. And along with that, the antimalarials. So I'm hoping most of you are on hydroxychloroquine or Plaquenil or chloroquine as antimalarials, because they have so many benefits in lupus. And in particular, one great benefit, it's really preventing flares, and not just any flare, but specifically kidney flares. So that's a medication that helps us a lot towards that end. So it's really a combination of all of these treatments that can help us get to our goal of controlling the kidney disease and keeping it under control for the long run. Next slide. So now we'll talk a little bit about, living with lupus and how to deal with this, besides going beyond the treatment, which we know it's vital, but along with that, we also need different steps and other things to be looking out for. You've already taken the first step today because you're here with us and you're learning about how to manage, how to identify any flares. So you've taken that initial step. So we're very happy that that's the case. So besides those treatments, the medications per se, you're your best advocate, and you have, and some of the things that help get you there to the ultimate goal of your healthcare team. So it's working very closely with them, because nobody knows your body better than you do. So we're checking on this test, but it's important to know, which are some changes in your body and how you're feeling that could be important, and that your doctor would not know otherwise. So important to be in close communication with all your healthcare team, nephrologists, cardiologists if they're involved, your rheumatologist, of course, primary care provider, and learning. So you're here, so you're hearing me talk, and you're becoming an active participant in your care, because now you can go and ask your doctor certain things, point out some findings, some changes you've noted. And also, relying on just living a healthy life. So we know that, of course, diet and exercise are essential. They have a lot of benefits, not only particular to kidney, but just in general, cardiovascular health and just overall long-term good outcomes. So a healthy living is essential, and it has to be this, this compound combination of addressing all of these things that ultimately help you and get you to be where you want to be. Next slide. So who are those essential members, potentially of your healthcare team? So sometimes, especially at the time of diagnosis, it can feel, even overwhelming to just be told you have this chronic condition, you're going to have to see this doctor, the other doctor. It might feel like it's too much going on. But then you start to realize every specialty offers a unique perspective, and it's able to help you reach your goals in a different way. So the more the help, the better. So, usually your care is driven by your primary care physician and then your rheumatologist. But then depending on which manifestations of the lupus occur at different points in time, then we often need to involve our other colleagues, specifically the kidney doctors when nephritis occurs, because those are the people that perform the kidney biopsies, and they also help us if things progress and things like dialysis are needed. But also, the diet, as we mentioned, and exercise are quite important. So sometimes we like to have the help of a dietitian, a nutritionist. Often, it can be overwhelming. Overall, this condition affects young people. So it's harder the younger you are to be dealing with all these medical problems, when most often, young people don't really have to have those stresses. So some help from a psychologist is also quite good, just, for your general mental health or just moral support. So all of these providers, all of this team, they're at your disposal. It's really beneficial. So just to make sure every concern is being addressed, nothing's overlooked, because we all have the ultimate goal of, getting you well, helping it stay that way so that you can live a long, normal life. Next slide. So, one of the things that's, of course, essential in stress, some of that is the working closely with your healthcare team. But we know that that's been even a little bit more challenging lately with the pandemic and everything, and access to care. Sometimes has not been as easy or it hasn't been occurring in a similar way as it used to in the past pre-pandemic. So recently, in a survey from the World Lupus Federation, they noted that half of lupus people felt like they were not having at least one aspect of their lupus care properly addressed because of problems with access. So access, has really become a bit different during the pandemic days. So some of the tips that we can follow to try to, again, be your best self-advocate and make sure nothing is falling through the cracks is, making sure to keep track of those appointments. Even the supportive staff at your physician's offices, they have been, staying at home or switching jobs, or there's been all of these issues in all the healthcare system. So make sure that nothing really falls through the crack. If they miss something, well, you're on it. Well, so my appointment was canceled. I don't have another one. The doctor told me they needed to see me in a certain amount of time. So just keeping on track of certain things like that, so that if there's a breakdown in communication or the system, that doesn't lead to poor outcomes. So also, it could be, as I mentioned, overwhelming because lupus affects so many different parts of the body, so many different organs. So it's important that if needed, write down some questions, write down some of the symptoms, some of the things you think have changed that could be important, so that you don't forget once you go to your doctor's visit. Also, keeping track of making sure you're getting your blood work, your urine work, that usually things are being monitored at least every 3 months. So, if it's been longer than that and that kind of thing, make sure that you just bring it up to the attention of your providers. There was some delay, some cancellation, and now it's been 6 months and nothing has been checked. So that sort of thing. Also, it's really important bringing all your medications to the appointment so that there's no doubt in which medications you're actually taking. Could you have run out of something that was important for you to be on? Sometimes it helps to bring a family member, a close friend to those visits because, of course, it could be a lot. So a lot to remember, a lot to talk about and address. And sometimes it's easier for someone coming with us to just say, oh, babe, remember you also mentioned this and that. And why don't you tell the doctor about that? So all of these things are some tips that really can come in very handy and be very helpful. And most important, ask all the questions that you have. If there's anything you're really not sure about, you think it could be something, might as well just express it and make sure that you get your doctor's opinion on how to move forward from that, and if that's something that needs further investigation or if it's something that's just okay. Next slide. And okay. So bringing up what we were touching base on some of the challenges with COVID, that things have changed to some extent. And now we have, that part of working with your healthcare team is remotely. And that brought telemedicine to really a different level and a very common feature now of our healthcare system. So important to just, make sure that you're prepared for those telemedicine, telehealth encounters, because they require some things from you. That you must have some device that is equipped, that has video, that has, proper microphone function. So just making sure that, that you're able to do those and take advantage really of this option as a visit, or as something to get you closer or faster access to your providers. So now that this is available, of course, you could perhaps be seen faster, or if there's just some, for example, a rash that newly developed, and you are not able to really come into the hospital, but through the video, you could easily just, show that to your provider, and that might get everything, the ball running earlier than later. So important to know of the benefits of these ways in the healthcare system now, to use them to your advantage, and make sure you're prepared to really enjoy those kinds of encounters and close contact and communication with all your healthcare professionals. So we can go to the next slide. And now, over the last few minutes, we'll talk about going beyond medication. So we mentioned, yes, treatment is vital, but beyond the medications, there's other things that we can be doing and that are clearly beneficial to lupus nephritis, and your overall health. So some of those things are eating right for your kidneys. So which lifestyle choices we make, that has an impact too on the overall health of your kidneys and your cardiovascular health. So we mentioned that often we see elevated blood pressures when there's kidney disease. So making sure you're picking a diet that is low in salt and sodium, that is not avoiding processed foods because of similar reasons. They have a high content of that. So also eating small portions, making sure you maintain a certain weight, healthy proteins like chicken, fish, making sure you're including a proper balance of your fruits and vegetables. So all of these things are also important to make sure that you maintain that kidney and overall cardiovascular health. Next slide. So, along the sides with that, proper exercise. And I cannot emphasize this more because, often especially when starting treatment for nephritis, you're giving high doses of immunosuppressants and steroids. And one of the things that steroids can do is actually decondition your muscles. They're helping your inflammation, but on the other hand, some of the side effects include that they decondition your muscles, they turn some of your muscle mass into fat. So even more so than ever, while having a flare of the kidneys and being on all of these therapies, it's important to be active. So exercising regularly so that doesn't happen, that deconditioning, keeping your muscles and joints strong. So some of those exercises that are low impact, and especially if you're having a flare of arthritis, it might be difficult to do, like the higher impact ones, but walking, swimming, yoga is very helpful, not only for the exercise part, but also because of the mental health benefits of relaxation and yoga. Those could be all very helpful and strongly encouraged. And to incorporate it into your daily routine, just trying to have that balance with everything that could be beneficial for your overall health. Next slide. So as you've noticed, the point of this is to emphasize on you being your best advocate, along, of course, with the strength that's provided by your community, your team of healthcare providers, but knowing that you have, the power and knowledge to really pinpoint when something is changing, when something needs to be addressed. So you're really driving your care here, of course, with your team of supporters. Next slide. So, and along those lines, again, important to how you make sure you're properly communicating with your doctors. So sometimes it could be there's too much you want to discuss, and you feel like maybe there wasn't enough time. And some of the tips I mentioned can help you organize and prioritize what is it that has to really be discussed. But some of those tips and making sure that you're in tune with everything that's going on and you're aware of how the lupus is doing, how the kidneys are doing in particular, is just making sure that when you go for your visits, you ask your rheumatologist or other providers, how were my last results? Was everything okay with my kidneys and the urine tests? Or if it's been a long time, like I was mentioning, we have to be checking on these things periodically. So we say roughly every 3 months so that nothing gets missed. So if it's been longer than that, just asking on, are my kidney tests going to be measured today? How's that going to be done? Is it time to do so? So all of these things help you and your healthcare providers make sure everything is addressed in a timely manner. So, important that you feel comfortable in doing this, bringing up all these questions to the attention of the provider, making sure you're prepared to know which signs and symptoms you're looking for, what could be important for me to mention to you, or, and what are the consequences of this too. If you had this urine and blood test and you're told that they were abnormal, there could be some issues with the kidneys. So what could happen? What are some of the complications from that? What could I do to minimize some of those potential long-term effects? So all of these are very important points to bring to the attention of your doctor and to keep you well informed. Next slide. So, and just to kind of summarize, so what we've been talking about today, it's you just want to make sure you're well engaged, well informed, and that you're 100% aware and informed of everything that's going on every step of the way. And to summarize some of that, so you understanding your risk is part of it. So knowing that, yes, because lupus nephritis can occur quite often. It happens in half of people that are living with lupus. So important that I'm being maintained informed from my providers on how that's being tested, making sure it's being done properly and in a timely manner. So we said roughly every 3 months, usually looking at your urine, your blood test, discussing your options with your healthcare team. Okay, this is going on. What's our next step? What should we do? What are the treatments that would be appropriate at this time? And keeping that learning curve, because we're all learning something new about lupus all the time. And, and thankfully, as now we have more alternatives and more options in terms of how to take care of our patients, then yes, we keep on learning this. So that's one of the key things. And with this, I'd like to end this part of the presentation. And in just a few minutes, I will be answering some questions if you have some. But first, I'll have my colleagues share some information about Aurinia's All-In for Lupus Nephritis program. So I'll leave you with Michael now.
Thank you for that excellent presentation. So we do have an All-In for Lupus Nephritis program, a patient program. Next slide, please. And you can see that this is on our website, allinforln.com, and it's an introduction to the All-In program, and it's time to bring lupus nephritis out of the shadows. So can go to this website to access some patient brochure and to sign up for mailings. Next slide, please. And you'll receive some information on your lupus nephritis awareness kit along with newsletters. So next slide, please. And you'll be able to join the All-In community, and this can help you feel informed and supported every step of the way. Once again, it's allinforln.com, and you can check out the All-In Facebook page for tips and information with Facebook at All-In for LN. And you could also be sure to sign up for your lupus nephritis awareness kit at allinforln.com. So thank you, and like to go to the Q&A.
Yes, thank you so much, Dr. Geraldino. And also thank you so much, Michael, for giving us information that I think is so needed in our communities. I am excited to share this with everyone. So just if you guys can bring up a couple of the questions. We have 2 pre-submitted questions that Michael is going to read out and Doctor is going to answer. And then we will be going on to the questions that the audience has typed in the comments. So we'll start off with Michael. Can you read one of the first pre-submitted questions?
Yes. So why is a renal biopsy needed to diagnose lupus nephritis?
That's a great question. So we mentioned other tests, but why get to a kidney biopsy? So I know that people are often not very fans of having a procedure done, but the key thing about getting the biopsy is that it's really the way to confirm exactly what extent of the kidneys are already damaged versus actively inflamed versus what type of nephritis, because lupus can affect the kidneys in different ways too. So it really helps you not only confirm that it's really lupus nephritis, but also to give you an idea of what would be potentially the best treatments for you. And also how much of what's already happened in the kidneys is likely to respond to these treatments. So for all of those reasons, it's really the best tool we have.
And go ahead, Michael, read the second question.
I appreciate it. So I guess we have the second question is, what are the early signs of renal hypertension?
So early signs are that really it's having your blood pressure measure at a clinic or if you have your own device. Sometimes when we know that is someone who's already had kidney involvement and their blood pressures have been difficult to control, we give people the blood pressure cuffs to measure at home. But the early signs are really could be very subtle. So unless the blood pressure is really high, most people don't have any symptoms. And that's really the key here, that you could be up and around not knowing that anything is going on until things are late. So when the blood pressure gets really, really high, that's when things like heart attacks or strokes can happen. So that's one of the things that, of course, we want to identify everything before it gets to that.
Perfect. So now we are going to go to the live questions. And Michael, can you read this one for us?
Yes. So I think this question comes from Dina. Can shortness of breath be caused by lupus nephritis?
Well, hi, Dina. So yes, it can absolutely be caused by lupus nephritis. As we mentioned, what happens when there's nephritis and the kidneys are not working properly, so they're not eliminating, that they're not keeping that balance of fluid in the body properly. So that retention of fluid can back up. We often see that the legs start swelling up because of that fluid retention. And that's where you can see it. But similarly, that can continue to back up and that can cause then fluid retention all the way up to your heart. And then that can cause shortness of breath as well when things are quite advanced and there's just a lot of protein that's being leaked in the urines and you just retain all that fluid. So absolutely, yeah, that can happen too.
We are learning so much today. You know, me as a caregiver, I don't have lupus myself, but two of my sisters do. And I think all of these questions are great questions to be answered, and also for us to learn more about and how we can help them. So we'll go with the next question. This next question is going to be from Christine, and it says, when protein in your urine is present upon your diagnosis of lupus is diagnosed, is there a greater chance that of developing lupus nephritis, kidney cancer, or any other kidney-related issues?
So yes, so that to some of that. So yeah, the protein that's leaking in the urine, it's often the first indicator for that lupus nephritis is developing. So that's really that first test that points us in that direction. So often when that's happening, and we have to think that for the most part, it's young people that are getting lupus. So unlike the elderly that can have a lot of other comorbidities and other explanations for why their kidneys are leaking protein, for young lupus patients, it's usually the lupus because that tends to be their main disease. So yes, we do more investigations, but when we see that there's leakage of protein in the urine, then you're at higher risk, or it's already indicative that that's lupus nephritis that's happening. In terms of things like cancer, not really correlated that if you've had lupus nephritis that there's an increased risk for you to develop cancer of the kidneys. There's been in general some association though with some of the treatments that can be used and that are not used so often anymore, but more so in the past. So there's no linkage to that. Because you've had lupus nephritis, you will really have a higher risk for cancer. But certainly seeing that protein in the urine, yes, that increases your risk for developing lupus nephritis. We'll always confirm it, do further testing, and if needed, of course, the biopsy, and treat it so that we can prevent those long-term irreversible changes and damage.
Perfect. Thank you. Michael, do we have another question?
Yes, we do have one from Wanda, and it's, how does high blood pressure cause damage to renal function?
That's a great question. So what happens is that the kidneys are really that organ that's filtering your blood. So and in lupus, because of different things going all the way from that, we know, and we didn't really talk much about cardiovascular disease during this program, but also patients with lupus get atherosclerosis, which means that it's that like deposition of fat around the vessels, around the walls of the blood vessels. So that leads to like a narrower lumen and high blood pressure. So we know that happens. Usually that happens more to the elderly and people with a lot of other conditions. But in lupus, just the inflammation that comes with the condition can cause that. So we have that. Then we have that some of the side effects of things like the steroids can lead to that. So we get this system in which our kidneys are trying to filter the blood from our body, but then the high blood pressure is causing an imbalance in not only pressure, but how much perfusion, how much flow, and at what rate comes to the kidney. So that's how some of that gets disturbed in a way. And yeah, the kidneys is all this, it's composed of all these small blood vessels. So when you have this dealing with high blood pressures, then that also impacts on, of course, that kidney health, because that's your organ filtering all of your blood. So then it becomes more forced, more, it's in trouble, struggling when you have high blood pressure, especially when it's chronic.
Wonderful. Thank you. And we still have time, so we're going to go to the next questions. And this one comes from Yvette. Why is hydration crucial to keeping a healthy renal function, but drinking too much water can also have a negative effect?
So yes, so there's many things that can impact the kidneys that in a negative way. So when we're dehydrated, then I was just mentioning, yes, the high blood pressure and coming to the kidneys. When we're dehydrated, we're just not getting enough flow to the kidneys. So that's what happens. So also not having enough flow to the kidneys damages your kidneys. So because of that, and water is the main component in our blood. So we have to keep that balance of being well hydrated so that our kidney perfusion, that blood flow that comes to our kidneys, remains normal so that they can continue to function in a normal way. In terms of, like what is too much water to be drinking, that's very particular to certain conditions. Like in general, if you have lupus nephritis, most of the times you can drink. It's important you stay hydrated, but also that there's no limitation really to your water, to your ability to drink water. It becomes more of an issue because the kidneys are so damaged, then some of the electrolytes, things like the sodium, are very low. And because of that, you want to try to balance out the content of those electrolytes with how much water you're taking. But unless, that's been specifically identified by your doctor, you're free to drink your water. And the goal is to keep well hydrated. There are certain conditions, like I mentioned, some extreme electrolyte abnormalities there in which your doctors might tell you to restrict how much water you take, your intake of water per day. But for the most part, it's not usually necessary to be doing so.
Like I said, this is all amazing. These questions are amazing, and again, we keep learning. So hopefully, I think we have, like I said, we have a good time. So we're going good on time. We're answering questions.
And these are great questions because they could be tricky, right? I mean, you're retaining fluid, so you want to make sure you're doing the proper thing to keep things in the right track. So yeah.
Exactly. Let me see if we could have more questions here. Okay, so we have another question from Dina. So does diet and nutrition play a role in lupus nephritis, either from a preventative stance or a disease management perspective?
So yes, as I was mentioning, the diet, nutrition, lifestyle choices are very important as far as your general overall healthcare, and not just for your kidneys, but for the general cardiovascular health. That's where it becomes particularly important. So of course, because we're particularly concerned about high blood pressure, that's why we emphasize that when there's lupus nephritis and it's associated with high blood pressure, that you want to make sure that you're keeping a diet that's low in salt, in sodium, and avoid preserved processed foods. But even when it's not nephritis, it's just general. We know that having lupus just increases your risk for cardiovascular diseases like heart attacks, strokes. So even without the nephritis certainly is another factor that makes that more likely to happen. But in general, it's good for everybody to be healthy. But once we know we have lupus, we want to make sure we're addressing everything we can to keep everything as good as we can. So not so much for preventive purposes, it would be more for prevention of those complications, potential complications, not so much of preventing getting nephritis, for example, but knowing to keep that healthy diet to prevent things like heart attacks, stroke. So more of those down the line or longer term complications. One thing that has also been very linked with general lupus flares is when there's a low vitamin D level. So one of the things that is encouraged is to make sure you're eating properly so that you have a good balance for your vitamin D. But often your doctors are just checking your levels. Your lupus doctors are just checking because it's something that's really easy to supplement. And especially a lot of the vitamin D comes from the sun. And we know that the sun is not particularly a good thing when we have lupus because it can trigger flares. So acknowledging that most likely you're avoiding the sun, putting sunblock on, we're often checking for how the vitamin D levels are and supplementing that whenever it's needed, because that's something that's particularly linked with flares of the lupus.
I'm so glad you brought that up, because I always, I don't have lupus myself, but vitamin D does tend to increase my flare-ups with fibromyalgia. So that was one thing that I know has been asked a lot of times in the lupus community. So what we'll do is we'll see if there are any more questions for the audience. If not, oh, look at that. A great comment here. So Wanda, thank you for joining, Wanda, by the way. She says, thank you, doctor, for answering
my pleasure.
questions. Yes, it's amazing. David, thank you for all the information. And this is great because getting the information from you directly is amazing. Fantastic presentation, Ms. Laura, and deeply appreciated. Because a lot of the times we don't want to give wrong information, right? I'm not an expert with lupus, so I cannot, I can provide the resources like the all-in program resources that Michael was highlighting, and, and all these amazing tips that you guys have been giving. And look, Jorge was just saying that. Thank you, Flor, for joining, and she's thanking you, because it is so needed in our community. We need programs like the All In for Lupus Nephritis, where we can not just provide the information, but also have the resources available where people can go sign up for these brochures, where they can get the information, where they can learn how to communicate better with their providers and be able to be part of that care that is greatly needed. And I think most importantly, that is what empowers us as individuals, as those living with these conditions, to have the information readily available, to share with our community, and most importantly, to empower them. So it's just amazing. All these all these comments are bringing a smile to my face. Emmett, is an amazing patient advocate. I'm glad he tuned in. Thank you, Dina. She says, we are blessed and grateful to have you with us today, doctor.
It's my pleasure.
Yes. And Michael, oh my goodness, what you guys are doing at Aurinia, providing these resources, these tools, I think that's another way of supporting the communities, because sometimes, with lupus flares, they're so unpredictable. Maybe they don't need the information 8 to 5. Maybe they just want to be able to get to it maybe at a night when they can't, sleep or whatever it is. And then they go to the resource page. So thank you, Laura, for joining. Christine, thank you. Good to see so many familiar faces here. I miss you all. Thank you for all this information. I just love it. I can't stop smiling. Thank you, doctor, for giving us.
I'm very glad this was helpful. And like you said, we really need a lot of this. It's important that, you feel empowered, what's going on, you're involved. And yeah, no one knows your body better than you. So it's essential. So I'm very happy to help in any way I can.
Yes. And just to be mindful with the time, it is 12:59. Thank you all that attended today. Thank you for the questions. Thank you, Michael. Thank you, Aurinia Pharmaceuticals. Thank you to the All In for Lupus Nephritis program and campaign. Thank you, Dr. Laura Geraldino. Is it Geraldino or Geraldino?
Geraldino, you got it.
Geraldino. Geraldino Padilla for being here today. There goes my voice. And for providing all this amazing information. And remember, this is going to be recorded. So if you want to come back and watch it again or share it with others that were not able to attend today, please share and put in the comments and questions. We will continue to be responding to them. Thank you again, Michael, Dr. Geraldino, and all of us that were here behind the scenes. I'm just so proud to be able to provide this information to the community.
Thanks to all for having me. It was a pleasure.
Thank you.